you remember, in 2004, Sachin Tendulkar was not able to play the game and was haunted for 2 years because of one thing. Yes, tendinitis. He suffered from tennis elbow. So what is tennis elbow? What is tendinitis? Let's dive deep. So tendinitis is a condition where the tendon is inflamed. Now what is a tendon? A tendon is a connective tissue that connects the bone and the muscle. So when this is inflamed, it is known as tendinitis. So why does it get inflamed? There are multiple reasons to it. If you do a repetitive activity for like a prolonged time, it can get inflamed. Say if you are already injured but you still don't pay heed to it and you still are doing your activity, it can get inflamed. If you repeatedly put a lot of strain on it, it can get inflamed. So these are basic things why we get tendinitis. Now looking at the sites where actual tendinitis can happen in our body. So starting from our shoulder, we can have tendinitis here. Elbow, very common, tennis elbow, golfer's elbow. Then we can have it at the wrist, at the base of the thumb is a common location. Then knee, base of the kneecap. Then we can also have it at the connection at the calf muscle, the calf and the heel. So between there, that is also a very common place. So these tendinitis are most commonly seen in athletes. And now looking at the symptoms, or what do you face, what do you feel when you have tendinitis, is there is soreness of muscles around the joint, or the joint aches, or whenever even you're doing any movement, the pain is triggered and the pain just worsens. That is also one thing. You can many times see swelling, inflammation, some amount of discoloration at the site. So what are the risk factors, or how often can you get tendinitis? So if you have poor posture, weak muscles, poor elasticity of the tendons, usually after the age of 40, the elasticity tends to decrease according to research. So after age of 40, we should be a little cautious about what activities we do, how repeatedly a movement we do. So how can you diagnose if you have tendinitis or no? The very first thing you should do is come to us physiotherapists, because we have certain tests through which we can underline your condition. Second thing is MRI or ultrasounds. But X-rays, to be very frank, X-rays will not help, because X-rays we can only see the bony things. We can see if there is anything else that has triggered this. But to rule out tendinitis as a separate thing, it's very, you should just go for MRIs or ultrasound. So how long does this last? For him it was 2 years. But it oftenly varies from the severeness of the condition. It can take like for a few weeks to months. But this is a very sensitive condition, wherein if you even come out of it and you put repeated stress on it, you can again feel the symptoms, like the symptoms reoccur. So the best thing you should do is ice. Rest it, ice it. Many times you can heat it, but make sure you talk to your healthcare provider or us before you take your judgment on what to do. So the best thing, as I said, is resting it. Then we have certain splints that we get to help us immobilize the joint. So that is one thing. If you ask me how to avoid going into tendinitis or getting tendinitis, so I would say avoid staying at the same position for a very long time. You can take breaks in between, say half an hour, you just get up, move around, move your joints, and then continue your activity. Maintaining proper posture is very important. You just cannot sit like anyway. You can just have a proper posture that is maintained. And if you have to take something, grab something, you just don't twist your hands here and there and get it. Just make sure whatever you have to grab is right in front of you and take it. Even when you're taking it, you just grab it. You don't have to squeeze it. You can just hold it firmly. That is also good enough. Nothing is going to fall off. If you have to get something from overhead, you can again place yourself centrally to the thing and then take it down. Also make sure you use both your hands if the object is very heavy, because if you lift it with one hand, there are multiple areas that can be strained. The best thing to do is start with normal stretches and warm up before you do your activity. And one thing is for sure, if you start feeling pain in any specific area, make sure you stop it there. You don't have to overdo it. Another tip that I would like to give you is, if when you're starting something new or you're starting some activity, make sure you do it a little gently and consciously. You don't have to do it very aggressively and in speed. You can take your time and do it, because maintaining the health of your body is really important. Now looking at some dietary guidelines that you can follow is consuming vitamin C, because the collagen that vitamin C produces improves the body's ability to help maintain our muscles, bones, tendons. So it's really good in that way. So what are the sources of vitamin C? We can have tomatoes, oranges, grapes, bell pepper, kiwi. Moving on, omega-3 fatty acids help with inflammation. So to reduce your inflammation, you can have something like walnuts, chia seeds. Omega-6 also helps, but the sources of omega-6 would be oils, and most commonly for people with arthritis, coconut oil is helpful, so we can go with that also. Now, vitamin D and calcium both go hand in hand, because vitamin D helps enhance the body's capacity to absorb calcium. And calcium is anyway very helpful for our bones. Some things that you can have for calcium and vitamin D would be broccoli, almonds, lady's finger, sunlight, Fibers are something which are very important, because in case, not just do this tendinitis as such, but even when you are immobilized, like you have a bed rest, then you can you just eat and then you gain weight. So how to lose it? It's going to be a little problematic, and it takes a lot of time. So what we can do is, when we have high fiber food, it helps us feel full quickly. In that way, we can maintain our weight. And protein, as you all know, who is your best friend with gym buddies and all, it helps us reinforce the muscles. These are the few things I had to discuss today. But make sure you subscribe and like and share, and stay tuned, because I'll be coming with exercises on how to stay fit and help your tendinitis.